Good afternoon, everyone, and welcome to Wellness Wednesday, presented by the University of Arizona Health Sciences. I'm Caroline Berger. I am the Director of Corporate and Community Relations for Health Sciences here in Phoenix. And I'd like to introduce you to our team, led by Allison O'Toole, our Executive Director, and Anne-Marie Medina, who is Director in Tucson. We hope to stay engaged and invite you to connect with us, and there's our contact information, and you'll find some more as we go further through today. If you're not familiar with the University of Arizona Health Sciences, I'd like to take a minute and introduce you to us. If you're not familiar, we offer colleges of medicine in Tucson and Phoenix, as well as the College of Nursing, Pharmacy, and the Mel and Enid Zuckerman College of Public Health. We have main campus in Tucson, as well as a booming downtown campus in the Biomedical Center in Phoenix. We are led by Michael Dake, Dr. Michael Dake, our Senior President for Health Sciences. We invite you, and speaking of health sciences, we invite you to mark your calendars for next Tuesday, June 30th, from 4 to 5 p.m., where you can join us for a live virtual tour and open house of the University of Arizona Health Sciences in Tucson. You see, health sciences extends across not only Arizona, but also the Southwest, provides cutting-edge health education, research, and community outreach services. We are a major economic engine to the state and employ nearly 5,000 people with 4,000 students and 900 faculty members, and earn close to $200 million in grants and annual funding through the year. Perhaps you've read about us in the news with our COVID-19 response and all the wonderful things our students and faculty are doing in response to that. For more information on health sciences, visit uahs.arizona.edu. And be sure to follow us on Facebook, Twitter, YouTube, LinkedIn, and Instagram. And I invite you to follow me on Twitter at Caroline E. Berger, and be sure to do the hashtag Wellness Wednesdays AZ. Today's interactive session, we invite you to leave a question in the chat function. Our presenter today will devote about 15 minutes to give us great information, and then we will have some time for your questions, and he'll provide answers as well. We will be following up with you with a post-session email with a brief survey and also links to all the resources and recommendations that you see today. We're also videotaping this, recording this, so be sure to share with family and friends the link that you get in that email. So without further ado, we're here today to discover how you can improve your sleep to optimize physical and mental health. Healthy sleep is necessary for good health and plays an important factor in cardiovascular health, obesity, diabetes, and psychological well-being. Today, renowned sleep expert Dr. Michael Grandner will present strategies for disconnecting at night and falling asleep faster. He will address common sleep problems and provide practical, real-world solutions. You will also learn how to use sleep in daily rhythms to optimize physical and mental functioning during the day. I think I can speak for all of us when this is something we really need, especially during these times. Dr. Grandner is a licensed clinical psychologist and director of the Sleep and Health Research Program at the University of Arizona, director of the Behavioral Sleep Medicine Clinic at Grandner University Medical Center, and an associate professor in the Department of Psychiatry at the College of Medicine, Tucson. He is certified by the American Board of Sleep Medicine and is a diplomat in behavioral sleep medicine by the Board of Behavioral Sleep Medicine. His research focuses on real-world connections between sleep and health. And you can find out more about his work at michaelgrandner.com, and we'll provide that link and information for you in our post-session email. But right now, please welcome Dr. Grandner.
All right. All right. Hoping the screen share is working okay. So I'm going to talk for maybe 15 minutes to give a very quick overview and crash course in why sleep is important for health, and a few basic tips and ideas on what to do about it. So let me get started at the very beginning. So let's start with the big picture. Sleep is a biological requirement for human life. Period. It is a foundational part of our biology. Why do we sleep? We sleep because it is part of how our body works. We sleep for the same reason we breathe and for the same reason we eat. It's just because it's a requirement. It's not optional. It's part of how we're built. And when you think about it, there's not that many other things on that list. So sleep is actually quite important. Yet our society perpetuates this idea that sleep is unproductive time. And there's nothing worse than unproductive time. So this has led to incentives for sleeping as little as possible and not focusing on sleep health. I'm sure everybody listening can think about times in their life or maybe even in their week where sleeping less was incentivized for some reason, whether it was that you had to do something for work early in the morning or late at night, or you had to take care of stuff, and you were rewarded for not sleeping in some way. And that's why we have a society that thinks things like this. I love finding sleep images online. So here's one I recently found. It says, let's stay up unreasonably late tonight and then complain about how unreasonably exhausted we are tomorrow. I love this image because it really helps encapsulate what the conversation around sleep is. I think we're increasingly becoming aware that sleep is important, but maybe not quite doing enough about it yet. It's important that this way of thinking that sleep is not important, that it's unproductive, will lead to things like lost full and partial days at work, decreased productivity and efficiency, poor decision-making and memory problems, or even depression, anxiety, and risk of suicide, weight gain, heart disease, diabetes, car crashes, accidents, injuries, and errors, getting sick more often, requiring longer recovery, decreased work-life balance and increased stress, increased alcohol, smoking, and other substance use, and even a shorter lifespan. So I'm not going to go into every single one of these in detail because I've only got about 15 minutes, but know that there's data on all of these. Sleep issues are surprisingly common. So here's some data that we looked at, looking at the percentage of people and how much sleep they get across the US population, showing about half of the people out there are getting about 7 to 8 hours of sleep, which is what's recommended. And a solid third of people are getting 6 hours or less. So this is where the problems are. In addition to how much you sleep, there's also questions about how well you sleep. So if you're looking at symptoms of insomnia, whether it's difficulty falling asleep, difficulty getting back to sleep when you wake up, waking up too early and not being able to get back to sleep, or even just poor sleep quality in general and just waking up feeling non-restored, lots of the population is feeling this way. So altogether, there's a large portion of the population where on a daily basis, they're walking around with each one of these symptoms. Then there's sleep apnea. Sleep apnea is another sleep disorder that's surprisingly common in both men and women, especially over the age of 30. So this figure shows the estimated proportion of the population that has at least mild sleep apnea and how it's tied to weight. So the darker bars are higher body mass index, so 30 and above is obese, 25 to 30 is overweight. And what you can see here is a large portion of men over 30, especially men over 50, have sleep apnea, especially if they're overweight or obese. And even in women too, there's a strong relationship. It's much more common than people think. So sleep problems are out there. And it's an important part of overall health. So here's some data. We looked at some CDC results looking at how much people are sleeping and how much it's correlating with things like obesity, hypertension or high blood pressure, and diabetes. And you can see a really strong pattern here that people who are in the normal sleep range of 7 to 8 hours have the lowest rates of these. And as you become a short sleeper of 5 to 6 hours, or especially a very short sleeper getting less than 5 hours a night, the rates of obesity, hypertension, diabetes go up by about 50%. Even long sleepers, people getting 9, 10 hours a night, also do have increased risk because most people, if you're getting very long sleep, that might be indicative of other health issues. This isn't just cross-sectional. This is sleep could actually predict worse outcomes. So those who get 6 hours of sleep or less are 55% more likely to become obese. They are 21% more likely to develop high blood pressure. They are 33% more likely to develop diabetes. All of these are conditions they didn't have before, tracking them over time. These are new onset of these conditions. Weight management is especially sensitive to sleep. People who aren't getting enough sleep or getting poor quality sleep are more likely to gain weight over time. They're more likely to gain weight faster over time, and they're going to have more difficulty losing weight. It's also important to note, especially these days, that sleep is really closely tied with the immune system, especially how it relates to inflammation and other endocrine and hormone systems. So lack of sleep increases systemic inflammation in the body. and also many hormone systems that regulate many body functions rely on sleep, everything from metabolism to sexual functioning to energy level. On the molecular level, you can see relationships with sleep. Sleep is also an important part of brain health. Sleep loss impairs your brain's ability to regulate emotions, process emotional memory, and regulate stress. Sleep deprivation increases stress hormones, depression symptoms, and pain sensitivity. And sleep disturbances feature in nearly all mental health problems. And I especially want to mention that poor sleep is a suicide risk factor. Suicide is a major public health problem. It's a second leading cause of death in all age groups between 10 and 34 in the United States. And you know, one of the things that we discovered a number of years ago, that the signal for suicide spikes in the middle of the night. So this may be one of the reasons why people who have insomnia are about 3 times as likely to have suicide risk than people without insomnia. So this is data we published a couple of years ago. And in terms of brain health, it's also important to mention that sleep is also important for removing toxins and waste from the brain, for learning new material, for integrating information and memories, which is why I always tell my students, you don't pull an all-nighter at least the night before an exam, because you're not going to remember. It's also really important for complex decision-making, as well as reaction time and focus. So reaction time and focus are variables that have been measured quite a lot in sleep deprivation experiments. And I want to show you some of those data right now. This was a very famous study that was done a number of years ago, where they had people in the lab. These were adults, otherwise healthy, in the lab for 14 nights. You can see that across the bottom here, baseline night to 14 nights of sleep restriction. And you can see 3 lines. One is a group that had 4 hours time in bed, the other is a group that had 6, and the other is a group that had 8. Don't worry about what PVT performance lapses mean, just know higher is worse. The more PVT performance lapses you have, the less able you are to focus and pay attention. And a few things you can see here. The less sleep you get, the more impaired you are, right? 4 is worse than 6, 6 is worse than 8. So the less sleep you're getting, the worse you're performing. Also, these deficits are cumulative. You're getting worse and worse and worse over time. How you are at day 1 is better than you were at day 2. And as you're going in through 14 days, your 14th day is your worst day. And you're getting worse and worse and worse over time. And the rate that you get worse depends on how little sleep you get. The less sleep you get, the faster you get worse. And something really important to notice here is after 2 weeks, you're not adjusting. You're not leveling off. You're just getting worse. And this is something that's been replicated over and over again to 2 weeks, to 4 weeks, and even longer, that there really isn't much in the way of recovery. People just get worse. But if you ask people how they're doing, they don't realize they're getting worse. They think they're leveling off. This is the self-reported levels of impairment. And you can see that after a few days, people think they start leveling off, but they're really not. So there's a couple of intersecting problems here. You've got sleep loss, which is related to both poor health and impaired brain function. And it's possible that these effects are overlapping. After all, many health conditions are made worse by increased stress and greater difficulty making healthy decisions. So, if we're all on board with this idea of sleep being important, what do we do about it? So first, I want to talk a little bit about disconnecting, especially these days. People are having a hard time disconnecting. A lot of people with insomnia have trouble turning their mind off, and they don't know why that happens. But most of the time, actually, this is a result of accidentally programming your brain to do this in bed. I'll explain a little bit about how that works. So what happens is, for one reason or another, something causes us to spend time awake in bed. But even when that original cause is gone, the insomnia takes on a life of its own because you actually trained your brain to be awake in bed. In order to avoid this from happening in the first place, I want to stress how absolutely important it is to give yourself time to wind down. You know, an airplane doesn't go from 30,000 feet to stop at the gate instantaneously. Our brain is also not a light switch. You have to give it time to come in for a landing, to land on the ground and taxi to the gate. You need to give yourself enough time. If you don't, So it's like if you're driving in a car and you're coming up to a stop sign, when do you start slowing down? You don't start slowing down when you're at the stop sign. That's how you miss it. You end up in the intersection. That's what happens with people who go to bed. They're going. They don't start winding down until they get into bed. And then their mind is still going. They're still slowing down, but they're slowing down in the intersection or in their bed, right? So you want to make sure to give yourself at least 30 to 60 minutes of less intense activity. You don't need to sit there on the couch and meditate for an hour. That would be great, but you don't have to do that. At least give yourself a chance to wind down. And this involves relaxing both mentally and physically. And this is relaxation, not necessarily distraction. Distraction just mostly hits pause on your thoughts and feelings. Sometimes it gives you some distance from them, but relaxation and distraction are different. Relaxation is an active process. You want to make sure you allow your mind to go over whatever it needs to do, so by the time you get into bed, you've already done it. And I do want to mention the role of mobile technology here. There's three different ways that mobile technology can interfere with sleep. One is the light exposure, one is the psychological stress, and the other is time displacement. Light exposure works because the light from the device itself gets into your eyes. And especially if it's in the white or the blue or green spectrum, it can send a daytime signal to your brain when it's looking for a nighttime signal. That can get confusing, and that can make it harder to fall asleep because your brain's not quite sure what time it is. The stress, it's not just that everything we're seeing on these devices is stressful. Sometimes it is, especially if you're watching the news lately. But part of it is also just this mental activation. You're getting all worked up. You're watching stuff that's interesting and engaging and hooking you. And then you're on to the next thing, and you have this constant, never-ending feed of things to read about and things to look at and things to get worked up about. So that contributes to the inability to wind down. If you've got to wind down from the thing you're using to wind down, you're using the wrong thing. The third thing is time displacement. This is where the distraction comes in. Sometimes these devices are so distracting, time goes by and you barely even notice. Have you ever been on your screen and then a half an hour went by and you didn't even notice that half an hour went by? At the same time, people are talking about not having time to sleep, but really what a lot of people they're spending time distracted that is not benefiting them at all. And you're not even noticing that you're actually getting sleepy or getting ready for sleep or becoming more relaxed. You're just so distracted you can't do it. So these three things together create that problem. Next, I want to talk about something called stimulus control. Stimulus control is probably the best bang for your buck sleep technique I could give you. It's extremely powerful. It, by the way, was developed here at the University of Arizona back in the early 1970s by Dick Lutsen, and is a core foundation of cognitive behavior therapy for insomnia, but it's generally something people should do. This will help you gain more control over your ability to sleep, even if you are mentally activated. Now, the idea behind stimulus control is that if you're in a situation with a very limited set of options over and over and over again, just by being in that situation, your brain will learn what limited set of options there are. So for people who go to the gym, even if you're tired, you get through the door, you get to the gym, you can make it through your workout because there's nothing else you do there. And the gym can put you in that zone because you're not doing lots of other stuff there. Same thing with a dentist's office. People hate going to the dentist. And then you're sitting in the chair, you're all worked up, even if nothing happened yet, because you learn that in that place is a stressful place. What you want to do is you want to teach yourself that the bed is the place for being sleepy and for sleeping. But what happens is people dilute the ability of the bed to trigger a sleep response. So what are all the different things that people can do in bed? It could be a very long list. There's all kinds of things that people do in bed. And when this happens, it dilutes the ability of the bed to trigger just sleep, and instead it's linked with all of these things. So the brain doesn't really know when you get into bed what it is you're supposed to be doing. The options are endless. Sleep is just one of them. And if anything, things like thinking and worrying start taking over. And that seems to be the thing that the bed starts triggering. You get into bed, you're thinking and worrying. You get into bed, you're thinking and worrying. You get into bed, you're thinking and worrying. The brain learns that when you get into bed, this is what you do. Even if you're tired, even if you didn't even have anything to think or worry about, you get into bed and you just start thinking. And sleep takes on a much smaller role. So what you have to do is you have to get all these things out of the bed. easier said than done. I can deal with some of this in questions, but you want to reduce these as much as possible so that what you're left with is a lot less of a question, and sleep can take on a much bigger, much more central role. Sex is fine, that can stay. But sleep, you want the bed to trigger a sleep response. And so one of the last things I want to talk about is sort of what I call the 10 sleep hygiene commandments. So sleep hygiene, there's like these sleep tips. Anyone can find them. None of these should surprise you. But I call them the 10 commandments because it's a joke. These are not rules written in stone, delivered from on high, that if you don't follow them exactly, bad things will happen. They're just loose guidelines. They're not really commandments. They're just ideas. So one is, thou shalt keep a regular schedule, clap of thunder, right? The brain likes regularity. The more you can build regularity into your system, the more you can use time and that schedule itself as a cue to promote sleep. Thou shalt exercise regularly, but not too late at night. This is another one. Exercise is great at sleep. Sometimes late night exercise can interfere with sleep, but actually it's pretty rare. Thou shalt get light during the day and avoid it at night. Bright light, especially in the morning, can not only send a strong daytime signal that can help prepare the body to know when to expect the nighttime signal so you'll be able to fall asleep. If you've ever had that experience of being stuck inside all day and you don't really get bright light during the day and your brain sort of doesn't even know whether it's early or late or what time it is, this is what happens. Thou shalt keep your bedroom cool, dark, and comfortable. That's not rocket science. Cooler is a little better. You want it pretty dark, and of course you want to be comfortable. Thou shalt not consume excessive foods or liquids in the evening. Foods consumed too close to bed can not only cause reflux or indigestion during the night, but also calories, it'll be more likely to get turned to calories than spent on energy. So the closer you eat to bedtime, the more likely you're going to gain weight anyway. And if you're drinking a lot of liquids at night, don't expect to not have to get up in the middle of the night to go to the bathroom. Thou shalt put down screens before getting ready to bed. We talked about this. Thou shalt not ingest caffeine, nicotine, and alcohol at night. Caffeine, we all know, keeps you up, can affect sleep 4 to 6 or even 10 hours later if you're sensitive. Nicotine, people smoke to relax, but nicotine is a stimulant and can make insomnia worse. And alcohol also. Alcohol can help you fall asleep faster, but it makes sleep more shallow and makes you wake up more. Thou shalt not go to bed angry, worried, or upset. Be angry, worried, or upset. I don't care. Just don't do it in bed for stimulus control reasons. I don't want the bed to be the place where you have these negative feelings. You want the bed to be a relaxing place where you can fall asleep. Thou shalt get rid of the clock. Now, a lot of people rely on the clock during the night. They wake up, they look at the clock. They wake up, they look at the clock. And then if they're still up, they look at the clock again. So some people can get so wrapped up in the clock that whatever the clock is telling you is bad news and just makes you more awake and more alert and more worried. So if you need to see it, turn it around. If you absolutely need to know what time it is, turn the clock around, take a look. If you need to wake up at a certain time, set an alarm. If your alarm hasn't gone off, go back to sleep. It doesn't matter what time it is, right? If you're practicing stimulus control, if you're in bed and you can't sleep, get up. It doesn't matter what time it is. So get rid of the clock if it's bothering you. And then finally, thou shalt not nap too long or too late in the day. Naps can be very good. They can help reduce fatigue, improve learning and memory, improve brain function, improve energy levels. But if you're napping too long or too late in the day, you'll wake up feeling groggy, and it might be like a snack before dinner, and you might not have enough hunger for sleep that night to get good, healthy sleep. So I want to do a quick plug for our lab here at the university. Here's our website, sleephealthresearch.com. Here's all the students and trainees, and of course, the people who funded our work. I do want to make a quick plug for our own seminar that is free to attend. And so thank you, and I'm available for any questions. And so I will stop the screen share in a minute. But but I want to put my email and Twitter handle on here so that if anyone listening wants to find me, I'm relatively easy to find, and people can ask questions.
That's wonderful. Thank you so much. I think this is something we could probably talk about for hours, but
I know
something we all need. We do have some questions coming in. Here we go. Are there ways to prevent sleep apnea? This one.
Yes. So sleep apnea, the best way to prevent sleep apnea is to avoid weight gain. Weight gain is the #1 predictor of people developing sleep apnea. The second one is age and gender. So unless you can avoid being male and avoid getting older, we haven't solved either of those yet. But weight gain is probably the most preventable risk factor for sleep apnea. A lot of people with sleep apnea don't know it. About 90% of cases are estimated to go undiagnosed. A good rule of thumb for sleep apnea for anyone in your family or your friends or you, think of there's an acronym we use. It's called STOP BANG, STOPBANG. You get 1 point per letter. S is loud snoring. T is daytime tiredness. O is observed breathing pauses during the night. If you've woken up choking, or if anyone said you stopped breathing during the night, that's O. P is high blood pressure. B is a body mass index over 33. A is age over 50. N is your neck if you have a very big neck. And G is gender of male. Each one of those gets you 1 point. If you have more than 2 points, go to a sleep center, get a sleep test. Your likelihood of having sleep apnea is pretty high.
Very good. How effectively do people recover from long periods of insufficient sleep, like in the research project?
Yeah, that's a good question. So in these research studies, people can go for weeks with poor sleep. Usually within 2 to 3 days, they're back to normal. But again, these aren't people who've been chronically sleep deprived before they came in. So we don't know what happens in the real world. This is a little trickier. There was also a great study done where what they did is they sleep deprived people, then they gave them 2 days of recovery, then they sleep deprived them again. And then they gave them recovery, and then they sleep deprived them again, over and over again. And what they found was at the end of 2 days, they looked totally normal. But day 1 of sleep deprivation, round 2, they actually picked up where they left off. They weren't actually totally recovered. They looked recovered. And what that shows is that there's a memory of that, and that even if you look fine after a couple days, you probably still need a little more time to actually get back down to being as resilient as you used to be.
Our 20
Think of it
minute...
like diet. So I was supposed to say, think of it like diet, where it's like people say, how much sleep do I need on the weekend to make up for a week of sleep deprivation? I say, that's like saying, how much salad do I need to eat on the weekend to make up for eating nothing but cheeseburgers and pizza all week? Like, it doesn't quite, the idea is to get back to balance long term. It's not about short term swings of the pendulum. So you're asking about naps.
Yes. Are 20-minute power naps during the day beneficial?
For people who are otherwise well rested, a 20-minute power nap can reduce fatigue, improve brain function, improve learning and memory, as long as they're relatively early in the day. Yeah, there's quite a bit of data on that.
Good. We'll take one more here. Any tips for sleep with menopause or menopause?
Yes, a couple of things to say. One is that people in perimenopause and menopause often report both sleep disturbance and daytime fatigue. It's extremely common. And one of the best things I can tell you is it gets better. The data are actually quite clear that sleep problems peak at between 50 and 60 for women, and then they'll get better and better and better over time. So that's good. The other thing is stimulus control is your friend. If you can't sleep, get out of bed. If you're waking up with a hot flash, if you can relax and get back to sleep, great. If it takes you more than 15 to 30 minutes, actually get out of bed, take a break, and go back to bed. If it means budgeting a little more time during the night to account for awakenings, that way it gives you enough sleep that you need, budget for more time. If you can't make the whole road trip on one tank of gas, budget for a pit stop, and it'll be a whole lot less stressful than running out of gas halfway through and then being late. That's what I would say. So do stimulus control. And one other thing, for anyone out there, if it takes you more than a half an hour to fall asleep, or you're awake for more than a half an hour during the night, unable to sleep, and this is happening 3 nights a week or more, and it's been going on for 3 months, you actually might have an insomnia disorder. And some of these tips aren't going to be enough. You might actually need treatment from someone at a sleep center, and not necessarily with medications. The data shows that the recommended first-line treatment for insomnia is actually cognitive behavior therapy, which is a training protocol that reteaches your brain how to sleep. If that doesn't work, then maybe try medications. Just letting you know about that.
Very good. Well, thank you so much, Dr. Grandner. If you would stop sharing your screen, we'll move on. But
sure.
What great advice and new commandments to hopefully abide by as we go along.
Same.
So thank you so much. And now we're going to, yes, you're welcome. And There we go. Next week, July already, we're going to continue our discussions on providing good health and lifestyle and wellness tips for you. We're going to talk about preventing and treating chronic disease with lifestyle medicine by Dr. Shad. It's coming back again, an encore performance. We're very delighted to have him here. And thank you once again for joining us for Wellness Wednesday. We hope this provides some health and some wellness information to you during these times and some good tangible information. Remember, you will be receiving a post email just following up on this either today or tomorrow, and we will include all the links and resources that were mentioned here. On behalf of Allison O'Toole, Anne-Marie Medina, and myself, have a wonderful day, and remember, bear down.